All right, you guys, it's really exciting. Also coming from the West Coast, we're going to introduce you to Charlene Platon, who's going to be joining us now to take over and tell us her own innovation story and presentation. Charlene.
Hi, thank you so much, Rebecca. Hi, everyone. My name is Charlene Platon. I'm Director of Ambulatory Nursing at Stanford Health Care, and I'm also CEO and co-founder of Fifth Window. And I'm honored today to present my Johnson & Johnson Nurse Innovation Fellowship project, which is focused on a topic that's really near and dear to my heart, and that is nursing well-being. But why did I choose this topic? I'm a registered nurse and nurse practitioner by background, and if there's anything I know with certainty, it's that nurses are the backbone of the healthcare system. Every single one of you listening today has received care from a nurse. But what I also know with certainty is that nurses have had enough. They are exhausted, they're tired, and they're leaving healthcare. Just this month alone, January 2022, I found countless social media posts by nurses talking about their experiences right now in healthcare. Despite the current state of the pandemic and the number of COVID-19 cases we see in this country, one constant has remained in this pandemic, and that is that nurses are at a breaking point. And what you might not know is that burnout has been prevalent in the healthcare industry for decades. I can't name a single nurse, myself included, who has not been burnt out at least once throughout their entire healthcare career. In fact, before the pandemic, at least a third of nurses and physicians were burnt out. And during the pandemic, burnout numbers have been even higher, and 66% of acute care and critical care nurses are considering leaving the nursing profession. In fact, healthcare lost nearly 500,000 workers since February 2020, and this mass exodus of healthcare workers has cost hospitals and health systems a whopping $24 billion throughout the pandemic. And on top of all of this, the stigma of mental health and seeking mental health support and self-care continues to be pervasive in the healthcare industry. This is a really heavy topic, and there are no simple solutions. But throughout this journey in the fellowship, I've learned that when it comes to innovation, sometimes the best thing to do is start. And that's what the Fifth Window team and I have done. We're called Fifth Window because we focus on multiple domains of well-being: mental, physical, professional, and organizational. The fifth window is the fifth dimension of well-being, which encompasses all of these different facets together. Our aim is to improve resilience by providing nurses with evidence-based coping interventions, decrease turnover with a supportive and safe nursing community, and increase the utilization of resources for nurses, especially resources made by nurses and for nurses. We are meeting nurses where they're at with our holistic hub for nursing well-being. Our first offering is a mobile app, and this is just the beginning. We currently have 3 main features, and the first is to check in or check inward, which prompts nurses to do a body scan and also be aware of their thoughts, body, and emotions. The next feature is practice. And so nurses can directly choose a self-care practice to perform, and all of these practices have been created by myself and by co-founders, really providing practices that are by nurses and for nurses. Lastly, we have our community space. This is an opportunity for nurses to share outward in an anonymous forum so they can share experiences and spread awareness that they are not alone and that we are not alone. We're also working on another feature on our app, which will promote resources for nurses, including our partnerships with nurse-led businesses and organizations that support well-being. And I do want to share that I wouldn't be a nurse today without mental health and well-being resources. When I was going through my training as a nurse and journey as a nurse, there were so many times that I thought I wouldn't be able to make it in nursing. And there were also times that I really struggled mentally and emotionally, but I was too ashamed to tell others. In fact, one of my own advisors told me that being an NP isn't for everyone. And in the times where I was struggling the most in my nursing journey, I got the least help, and I was left to my own devices to be my own advocate. And unfortunately, I continue to hear about similar experiences that my colleagues and friends are going through. And it's no wonder that nurses are leaving the profession with this type of environment. And while I was able to eventually find tools and resources to help me in this journey, I felt like I was all alone. and the only one struggling. This app is a tool that I wish I had when I was a nursing student, a graduate student, and a new grad nurse, and a place where I could safely connect with other nurses and where I could have immediate access to resources. And to talk about our app, we've actually had multiple rounds of beta testing among nurses, and we found that 100% of beta testers that completed our post-test survey reported that our app was helpful in reducing the work-related stress that they were facing during the duration of the beta test. We also received a lot of crucial feedback from nurses, and we really want to integrate nurses in this process so that our app is truly nurse-led, nurse-designed, and nurse-loved. This slide outlines our traction over the past 2 years. The Fifth Window team was formerly known as WellNurse, and our origin story began at the Nurse Hack for Health COVID-19 virtual hackathon in May 2020, where we won the Resiliency and Self-Care Challenge. And since then, we have had over 100 nurses enrolled in our beta tests. We had hundreds of nurses and healthcare leaders join our mailing list, and thousands of hits to our webpage. We've also been featured in multiple videos, 2 conferences, 5 news articles, and at least 8 podcasts. And one of my favorite things about Fifth Window is the community that we built around nursing well-being. To date, we've hosted 16 nursing spotlights, which are our monthly live stream events, where the Fifth Window team interviews and features nurses from all types of backgrounds and healthcare roles. And we discuss their nursing journeys and self-care journeys. These conversations have been truly fulfilling in seeing their impact, and here are several comments that we've received from nurses that have joined our events. What I'm most amazed about is how vulnerable and how open our guests and our community have been to these conversations. It really demonstrates how much this community is needed now more than ever. And in between the time that these 2 photos were taken, I've experienced significant internal growth. To be completely transparent, in the past 2 years, I worked with 2 life coaches, 1 entrepreneurial coach, 2 executive leadership coaches, and at least 3 therapists. And what I've realized is that your internal growth is an investment. Without this internal awareness, it's hard to understand what we really think and know who we really are. I've also learned the need to be kind to myself. Innovation is challenging, change is challenging, and there will be obstacles. Be kind to yourself, as these are crucial pieces of the innovation process. And to add to that, knowing your why is what carried me through some really challenging times during this fellowship, and it's a great way to stay centered. Lastly, I've learned that progress is progress. I'm a perfectionist, and I think a lot of healthcare professionals and nurses can relate. And ultimately, any type of progress that you make is progress. And something I continue to remind myself is that people are successful when they continue to progress and continue to move forward. We have exciting things lined up for Fifth Window this year. And earlier this week, we presented a workshop at the Healthcare Burnout Symposium in San Francisco. And we're also partnering with an FNP student from the Weber State University to validate the effectiveness of our app in reducing work-related stress for nurses in a community clinic. We're also focused on forming partnerships with professional nursing and healthcare organizations to have as many nurses use and provide feedback for our app as possible and really build a tool that supports nurses. And we've been connecting with organizations like BetterHelp, Lavender, Therapy Aid Coalition, and In the Rooms to promote their work on our platform and to tell nurses about the great resources that are out there and available for them to use. Our ultimate goal is to transform healthcare to be a culture that truly promotes psychological safety. We aim to put the care in healthcare and the care in self-care. We're bridging the gap between seeking help and getting help for nurses and healthcare professionals. Lastly, I'm excited to announce that our app will officially launch on February 8, 2022, which is Fifth Window's 1-year anniversary as a company. The app will be available for all nurses to download from the App Store or Google Play Store, so both on iPhone and Android phones. And to support this launch, we're currently raising money to enhance our marketing, including the improvement of our website and social media outreach. And again, this app is just the beginning of the work that we're doing with Fifth Window. There is so much opportunity to improve our healthcare culture and the well-being of those within our industry, and it's so much more complex than one solution. But the more that we can normalize self-care, reduce mental health stigma, reduce well-being stigma, and have these crucial conversations and be vulnerable and transparent with each other, the closer we are to making an impact. Big movements start with small actions. And lastly, there are so many people that I would like to thank and acknowledge: the Center for Creative Leadership, Johnson & Johnson, Nurse Approved, everyone who was involved in creating and building this fellowship and mentoring me along the way, my colleagues at Stanford Health Care who have been supportive of my nursing innovation journey, my co-founders who have been with me since day one to build Fifth Window and achieve what we've achieved to this day. And last but not least, my co-fellows. I'm so lucky and fortunate to be surrounded by an outstanding group of nurses who I can call my family. Thank you all so much for playing an incredible role in my journey. And we have our website and email address here, www.fifthwindow.com. And please check out our website on February 8th for our launch. And I'm ready to take any questions. Thank you.
Charlene, your presentation is just so personal and inspiring and driving forward. And I think it just shows that incredible passion in nurses that when they go out to solve these problems, it's often personal to them and then for their colleagues. And there was a question that was posed to us from Lynn Cooper, which is, have you been able to get traction with the health system where you lead? Because you lead all nurse practitioner care out of Stanford in California, and how the system has been able to support nurse resilience. Are you finding that there's some traction, and how has that been going for you?
I've been really fortunate to be in a health system that really supports nursing resiliency and well-being, and there's actually a lot of resources that our organization has. I would say that Stanford has been very open about supporting nurses and their well-being, and I've utilized, through this pandemic, I've utilized so many of the resources that are available to employees. They have just so many different resources available. And I also know that that's not the case for all organizations. So we're really trying to partner with healthcare organizations so that we can be that tool and that we, and get into those organizations, reach those nurses, because I know for a fact, talking to my nursing friends, nursing colleagues, that the majority of organizations, I would say, in which my friends and colleagues are part of, do not support nursing well-being as much as they should. And that's one of the future goals that we have for Fifth Window.
And Charlene, there's been some tremendous things that have happened for you being at Stanford, through being in this fellowship, first for nurses to join new committees and new positions within your organization. Can you enlighten us a little bit about some of those opportunities that have come your way and how that's helping you change the conversation to create that kind of a movement within your system?
Yes, absolutely. So by being a Johnson & Johnson Nurse Innovation Fellow, I do really feel that this opportunity has elevated my opportunities to pursue innovation work within my own health system. And so as a Johnson & Johnson Nurse Innovation Fellow, I was invited to be one of the founding members of our Technology Research and Innovation Steering Committee at Stanford. And so that integrates multiple entities within the Stanford community. And it's been really awesome to actually have a seat at that table, to be a nurse who's representing innovation at that table, and to have this group that actually has listened and has been really receptive to opening up the platform for innovation. So we've created a process, an innovation intake process, and I've been helping with that process to promote more nurses, especially ambulatory care nurses, to be part of innovation. So that's been a great door that's opened, and I think that absolutely nurses should be part of these seats at the table and should engage as much as possible and be part of these leadership opportunities.
Brilliant. And I think it's just such an inspiration to hear how both your and HEAM's systems, as well as Olivia's, have really started to adopt you guys into their folds of evaluating and moving nurses into those seats to drive it. Shauna Butler put forward a question. Fifth Window is a great tool in community. And I think Shauna was one of the judges back in the day when you actually pitched this back in 2020. So again, congratulations on how far you guys have come, just even from that. The question is, what other unmet needs have you identified that we can be encouraging others to be working on that maybe we haven't seen, because you are so close to the front lines here?
Yes, when it comes to well-being, there's just so many layers and so many complexities. And that's really why Fifth Window is a multi-dimensional company that's really trying to impact all these different levels of well-being. And so we were starting with our app to promote mental health resources because there is such an urgency and such a need for that. For the future, we really want to target all these other facets with physical well-being, professional well-being, and organizational, really equipping nurses with these tools that we didn't learn in nursing school, we didn't learn in our residency programs. No one has ever taught me how to take care of myself. And so in terms of unmet needs, there's a lot of room for opportunity. I think that it was mentioned earlier, we are a community of we. It's all about how we all work together to support this. And I think that we really need to change the thought process from the systems level, because nursing well-being and health and the well-being of the healthcare community is really requires everyone's commitment, everyone's involvement. And so I feel like there are many different opportunities that could be met when it comes to well-being. And so I hope that just to start, that we could at least just have these conversations. And I know that from myself talking with people one-to-one, it's been a great way for me to gauge people's vulnerability and to see how comfortable they are with their well-being. But I hope that answers the question. There's a lot that we can work on. And I think individually for nurses, a lot of that can also stem from self-compassion, how we view ourselves, because, we are incredible nurses, we are incredible people. And I think that this is just one component. And then just looking at the broader spectrum of well-being, how can we really target all those different facets?
Charlene, it's a powerful statement. We are incredible nurses and incredible people. And, just a couple more questions here, and then we're going to move on. But if you have not, there was a question that came in most recently about the New York Times opinion piece that recently highlighted nurses saying, there were some pretty tough criticisms of our current environments within healthcare at this point. The question that has been presented is, from the recent tape from the New York Times about how devastated nurses are feeling to providing an opportunity to see how nurses are shamed as they express their angst to this crisis. How do you think nurses could be more engaged and less shamed when having these conversations about the struggles they're facing on the front line?
I think it's a great question, and it's great to see that nurses are using their voice. And, that's something I've encountered in my nursing career. Nurses have really powerful voices, but from my experience, they haven't utilized their voices or don't know how much power their voices actually have. When I was at the bedside as a nurse in the telemetry unit, I had many brilliant colleagues who would not pursue their ideas or would not talk to certain people because they didn't think that their ideas would go anywhere. But it really just lends to how important, especially after seeing all these presentations today, just seeing the impact that our nursing voice can bring to the table. And I think that nurses should not be afraid to leverage their voice. And I think that they can start by first, when it comes to your own culture, your own organization, it can be really challenging because you really have to be careful and considerate about how you approach those conversations. And for me, when I was at the bedside and even now in my leadership role, I try to find those champions within my teams who I know will be supportive and who I know will have some great feedback thoughts for how I could continue to present these ideas in ways that are more, that will, sit well with leadership. And so, it was really guidance from my mentors when I was a nurse at the bedside that I was able to come together with a way to propose ideas, back it by data, back it by research. These were all things I would not have known if I didn't share these ideas with my manager or with people who I know who would have been supportive. So find your champions, find the people who have the same thoughts as you in terms of problems and the solutions that need to be made, and work with them to create those solutions, and then find a champion within leadership who could really help to move it to the next step. And I think that's just one way to do it, but finding that like-minded community is really a great start.
Charlene, I just love your story. You have done so much. You're in there empowering so much at Stanford and changing the culture and finding seats at the table. And you have taken this passion that you've had in this mental wellness and clinical, addressing it with this new solution. And you've inspired so many. I mean, the comments are just, I can't wait to share this with my colleagues and new hires as a resource. And just so many people saying and resonating with what you've said. So thank you so much. And we will see you back at the end of this to continue where we are today.
Thank you. And thank you for giving me the grace. I know it was a little tough in the middle there, but I really appreciate everybody. Thank you so much.